Good afternoon, everyone. Myself, Dr. Eva. I'm going to present my study, PREPP2, which is basically primary eye care in pediatric population, the second part. The first part of this study was done to know the clinical and demographic profile of pediatric patients who are presenting to 6 major vision centers in tertiary eye care center of southern India. And the second part of this study was done to know the satisfaction of the eye care services provided to the pediatric group of patients in the vision centers of Arvind Eye Care System, and also to know the barrier among the parents for not reporting to the base hospital when they were referred by the MLOPs there in the vision centers to the base hospital. So since the declaration of Alma Ata in 1978, the primary healthcare service has emerged as major milestone to achieve health for all across the globe. So when we talk about the primary eye care services, Vision Center plays an important part in delivering doorstep eye care services and is a key component to mission of eradicating needless blindness, and we follow the same at Arvind Eye Care System. But information on patients' perspective about the vision centers is very much useful for better understanding of utilization of eye care services and also the need of improvising the infrastructure. So there are numerous studies in the past literature where study of the satisfaction has been done in the eye care services, but these all, like major of the studies are done in the adult population. And to our surprise, none of the study, or there's a scarcity of literature on pediatric eye care services at the vision centers, and also the parents' perspectives on the same. So keeping this lacunae in mind, we did this study to assess the parents' satisfaction with pediatric eye care services across 6 major vision centers of a tertiary eye care hospital in southern India, and also to evaluate reasons for not attending the base hospital, that is the barrier among the parents on referral. So this was a prospective study of 6 months duration, and we included the study group in a pediatric population of 0 to 16 years. We designed standard validated satisfaction questionnaire, and the satisfaction factors that were evaluated were the accessibility of vision centers, the waiting hours, the financial aspects, the spectacle dispensing services, teleophthalmology services, and non-availability of dedicated doctors at these vision centers. Responses were assessed at a 5-point Likert scale, where a score of 0 meant very dissatisfied and a score of 4 meant very satisfied against each response. For statistical analysis, the responses were expressed as percentage with the score of 0, which meant very dissatisfied, and a score of 4 was given 100%, which meant very satisfied. Standard validated barrier questionnaire was also designed, and we evaluated the barrier factors like knowledge barrier, physical barrier, time barrier, and the financial barriers. In case of dropouts of the referral patients to base hospital, parents were inquired about the reasons of dropouts over telephonic conversation. So we got a sample size of 250 pediatric patients in a 6 months duration time. The satisfaction assessment showed that almost like 70% of the parents were satisfied with the vision center services provided to the pediatric population. But the most common reason of dissatisfaction was lack of doctor, or there's lack of the parents are not able to meet the doctor in person in the vision centers. So they were dissatisfied with that service. So when we studied about the barriers, we found that financial constraint was the main reason, because they couldn't afford to travel to the base hospital, or there was lack of transportation. The second most important barrier was a knowledge barrier, where the parents feel that the child condition might improve over time, or they didn't feel the need to report to the base hospital, or they felt that the child condition might improve over time, so they didn't report to the base hospital. So coming to the results, overall satisfaction was 75%, and the most common reason for dissatisfaction was lack of meeting the ophthalmologist in person. 14 out of 47 referrals didn't report and were evaluated using the validated barrier questionnaire. Majority had financial barrier, followed by the knowledge barrier. So coming to the conclusion of PREPP2 study, it demonstrated that 3/4 of the parents were happy with the services, but significant percentage wanted to consult the specialist at base hospital. 1/4 of total referrals didn't report to base hospital due to financial constraint and lack of awareness of the child's condition. Thank you.
So can I ask one question? You're saying that knowledge, they didn't have much of a knowledge. So what are the things that can be done to increase their knowledge, or how can we do it for the
Yeah,
community so that
definitely. Yeah. Much of the awareness programs have to be encouraged, or the MLOPs have to be much more trained the pediatric service delivery.
no, how do you have anything? Have you thought about it? You have just done it. So like giving informations and all it is going on, but
Yeah, ma'am.
have you any strategy for it, or?
Not for time being. This is just a recent study that we have done. So we are planning to do to implement more of the programs for pediatric eye care service improvement in the vision centers, ma'am. And most of the vision centers don't have the visual acuity
Infrastructure, yes.
infrastructure was not that much up to the mark for the pediatric eye care services, but it was like for the most of the adult population were covered in those vision centers. So we're thinking to upgrade those vision centers for the pediatric eye care services.